Hi, everybody. This is the Dr. Debunk weekly podcast show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Today's podcast, everybody, is going to be a three-part podcast, and it's called, or titled, The Antioxidant Inflammation Connection. The most important medical discovery of my lifetime. That's a big claim. So why is the antioxidant inflammation connection the most important medical discovery of my lifetime, your lifetime? Because chronic internal inflammation is the most destructive event that occurs to our body with age. Internal inflammation generally starts to go out of control in our 40s, and it just gets worse from there. And I'll explain it extensively in a minute. Well, the medical terminology, which is really a research thing, not clinical medicine, is dysregulation of our natural inflammatory control mechanisms. Simply put, we are losing our ability to control internal body inflammation. Internal body inflammation is natural. It's a process that we use extensively in the body. So what happens is we're slowly being internally rusted. If you leave a piece of steel out in the rain, unpainted steel, it's going to just be rusted away over the years. In the same way, we're being internally rusted by this chronic, uncontrolled inflammation all the way to death. There is no other factor that will accelerate aging and the march towards disease like chronic, uncontrolled internal inflammation. Here's the problem. We've never been able to do anything about this uncontrolled inflammation that occurs with aging. Medically. There are natural things that non-medical practitioners, naturopaths, nutritionists, non-medical things that reduce a little bit internal inflammation, but nothing that's direct, nothing that's powerful, very potent. Now, of course, I'm excluding drug therapies that reduce inflammation because they're not natural. Like steroids. But steroid therapies cannot be used to treat chronic inflammation. You can use them for acute, and we do all the time in medicine. Acute inflammation. I'll explain that in a minute. Okay. Oh, I didn't mention. If you try to use steroids long term, it has devastating side effects like dementia, osteoporosis. It'll wreck all your hormone building systems, and your immune system won't work. Well, most people don't like that movie. So even today, after 60 years of steroid use, we really don't know how much to give people over their lifetime. Some people can take a lot. Other people I've had patients that have had very little repetitive steroid use, and it permanently devastated their bodies. Okay, so let's talk about inflammation, specifically chronic inflammation. The connection between oxidation and inflammation. So for over 30 years, we've been able to significantly reduce oxidation, or what we call the oxidative load in our body, with nutrient intervention, taking low-dose antioxidants. We've been able to put a little paint, shall we say, on the steel of our body to prevent that rust. But we've not been able to reduce the inflammatory load. There haven't been any natural interventions that could really change the level of our internal body inflammation until more recently, really like the last 5-6 years. The medical research that started about 6 years ago shows that we can use high-dose antioxidants in a unique way to directly block this chronic inflammation. And that is the connection. The antioxidant inflammation connection is that we can use a direct The antioxidant inflammation connection is that we can cause a direct anti-inflammatory change with much higher doses of the antioxidants to block the internal rusting of inflammation. And it truly is the most important discovery of my medical career. So why is this a big deal? So what if you block internal inflammation to a better degree? It's because a significant part of the speed at which you age is caused by this chronic internal inflammation. Furthermore, 50% of all medical conditions that people get over 50 years old are partially or fully caused by unregulated chronic inflammation, which is essentially saying 50% of all diseases. It's actually more. That is why it's so important. That is why this connection is huge, because of where chronic inflammation goes. Chronic internal inflammation is truly Pandora's box of disease, and this implies that we can regulate it back to normal. See, at low dose, antioxidants have one effect on the body, and we've been looking at that for 40 years. But at high doses, antioxidants have a very different effect on the body. And so for the past 40 years, health professionals, mostly not doctors, have looked at using low-dose antioxidants in the hope of preventing or slowing down the internal rusting of our body. I mean, for 40 years, researchers have been looking at natural antioxidants, but only at lower doses. And so it's also been hard to evaluate how much antioxidants do you need? How much are required? I mean, we're talking about effects regarding antioxidants that are thought to occur over 10 to 50 years. It's all been very debatable, the effectiveness of antioxidants, how much to take and which ones. Furthermore, doctors really don't care. We haven't been interested. And we're not, because you can't bring about a rapid change in patients' symptoms by giving antioxidants. I mean, it's not really a treatment option for us because, if you have a cold or flu or more serious stuff that could be affected, antioxidants aren't going to do anything for you in the acute clinical setting. But now we see that high doses of antioxidants have a very different effect on the body. Specifically, high doses of antioxidants block some of the main mechanisms of how the body causes chronic inflammation. And so now, based on medical science, both laboratory studies and human clinical trials, we can downregulate the level of chronic inflammation in your body in a dose-dependent fashion and produce rapid symptom resolution. Now, it's important to understand that external swelling or edema has nothing to do with internal inflammation. The term internal inflammation, we're talking about the chemical and metabolic reactions of inflammation, not fluid like around a sprained ankle. Plus, there's a difference between acute inflammation and chronic inflammation. The acute inflammatory response is what we call it, or the chronic inflammatory response. Now, acute inflammation is not bad. It's a mechanism our body uses to identify an injured part, an infected part, an overutilized part. But excessive or prolonged inflammation, which is the never-ending internal inflammation that's rusting us, that's bad. It's the chronic inflammation that we want to downregulate. Anyway, so from the research that's from the last 6-7 years, it's become very clear that our musculoskeletal system feels the brunt of this chronic inflammation. Or maybe I should say, in other words, we have so much of our body mass being muscles and joints and tendons and ligaments that we are aware of that part of our body being chronically inflamed. And so therefore, we start to have aches and pains associated with aging, but they're all from chronic internal inflammation. Therefore, if you eliminate the chronic inflammation, it will dramatically reduce or just get rid of aches and pains of aging. High-dose antioxidants work better than anything you will ever see to get rid of the so-called aches and pains of aging that we thought were normal, but they're not. So how fast does it work? Well, if you take the correct dose, high-dose antioxidants for 8 to 12 weeks, I'm going to be your new boyfriend because it will change you. How rapidly? Well, after 8 to 12 weeks, 50% of patients have no aches or pains anymore. Another 25% or more have a 50 to 75% reduction. Basically, 75% of patients have noticeable changes from this therapy at any age. Another way to say it is this: half of you listening to this podcast would have a complete resolution of your muscle aches and pains. No exaggeration, just plain fact. How do I know this? Well, because for the last 5 years, I've been getting these results with myself and my patients. I mean, I have 600-700 patients doing this now for a long time. Once you start, you'll never stop. And so, a little history on this so you understand it more. By the end of 2012, a significant amount of laboratory research had been done on the most famous antioxidant called resveratrol. You might know it as grapeseed extract or acai berry extract. It's basically the main antioxidant of the last 30 years. And we've been studying resveratrol for 30 plus years now. And there's well over 500 studies, clinical trials and laboratory studies. But in the last 6 years, the focus changed. Actually, more than that now, probably 7 or 8. The focus changed to inflammatory studies. So at the time right now of me doing this podcast, there are probably 13 or 14 clinical trials on resveratrol and 300 or 400 laboratory studies. Just a lot of research has been done. I can tell you to date that no other nutrient has been studied as much as resveratrol in the history of medicine and health and wellness. Now, I'm not talking about vitamins and minerals because those aren't nutrients. Those are essential vitamins and minerals. I mean, there's been work on those that goes back to the 1930s. But nutrients, non-vitamin and minerals, nothing's been studied as much as resveratrol. Now, why did this happen? Why did so much research get done? Because about 8 years ago, researchers realized the enormous potential of anything acting as a natural anti-inflammatory. I mean, I mentioned to you the catastrophic effect of steroids. And by the way, aspirin and ibuprofen and what you hear of called the non-steroidal anti-inflammatories, they only work on acute inflammation. They don't work on chronic. So the idea that a natural substance could have a chronic anti-inflammatory effect, it made researchers go gaga. And so that's what they did. Like little ants, they studied it. And so that's where these results have come from. The last 7-8 years and a massive amount of work. Now, I have to say all that because doctors like to just say about nutrients, oh, there's no good clinical trials to show that they work. There's no studies. But it's absurd because of the hundreds and hundreds there are. It's just doctors don't look at it. I mean, why would we? It's not a drug. So the rest of the podcasts today and the next 2 are going to be kind of an overview of how this works. Now, this podcast is really going to be a condensed version of a short little book I wrote. Wow, it's been 4 years ago. But I wrote a book after I had studied this for a year because I was so amazed at how well this worked. I mean, there is no nutrient, no substance. Of all the natural things I've tried to learn over the last 22 years, as I moved away from classical medicine, there isn't anything as potent as this. Now, you have to understand, I don't sell antioxidants. I mean, I don't care which ones you buy, where you get it from. There's actually, well, there were 2 antioxidants that were very effectively used and studied, but one of them's off the market. And there's some others that are coming up, but there's just not enough science yet. But resveratrol, there is no question how this works. So let me summarize this little introduction by saying this. Chronic internal inflammation has a powerful influence on how fast you age, how fast you get old, and how fast you disease, or if you get diseased at all. And it's true that many other things affect our aging process and our marching towards disease, but nothing, in my opinion, helps us to age as slowly as possible and resist disease like controlling internal inflammation. And antioxidants are not the only thing that affects internal inflammation, and internal inflammation is not the only thing that determines your level of health, or what we call optimal health. Okay, so I think we'll take a little break and hear a word from our sponsor.
Hi everyone, it's the cold and flu season again, and this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller.
Welcome back. Okay, after the introduction, I need to define for you a little bit about what oxidation and inflammation really are. Well, oxidation goes along with this other word called reduction. Oxidation and reduction are chemical terms, chemical reaction terms. And in one way, our body, our metabolism, how we work, we're just a walking chemical reaction factory. And it has a lot to do with enzymes and many other organic chemistry components or biochemical components. But very simply put, we use oxidation and reduction in many ways like a switching mechanism. We oxidize things to turn them on, and we reduce them to turn them off, and vice versa. We have something called ox-redox cycling, and basically it's all very complex, and it has to do more with medical research than clinical medicine. You can look it all up, but the terms you've heard of that are relevant to this are like free radicals and extra oxidizing molecules. I mean, we want to get rid of free radicals, and that's what antioxidants are about. And I alluded to that a little bit. And basically, like I said, too much oxidation is rusting your body. And simply put, one thing we see with age is we are starting to run out of reduction agents. And so reduction agents would be like painting the steel, and oxidation or oxidizers would be rusting us. And so that's what's given birth to the whole use of antioxidants to help our natural reducing mechanisms in the human body. Well, that's all different than the inflammatory control mechanisms and the metabolisms of our body that run around inflammation. Now, inflammation is much more complex and vast than the oxidation stuff. Inflammation involves numerous body systems. It's extremely complex, and I don't think we really even got it very fully until maybe 10, 15 years ago. And so it's always been separate. Oxidation reduction stuff has been a non-medical subject that naturopaths and nutritionists and other health professionals tried to affect naturally. But inflammation, acute and chronic, has always been a medical topic because we have anti-inflammatory drugs, a lot of them. And you can bring about immediate change. And so it's really been a medical thing. And so we always thought of it as two different movies. Oxidation is one movie, inflammation a completely different movie. But in reality, oxidation and inflammation are the same movie. It's just watching the movie at different times. Oxidation is kind of the beginning of the movie, and inflammation is the middle. And then degeneration and end-stage degeneration are the ends. And so I'm going to give you an analogy that we use in optimal health so you get it. You could say that the human body goes through 5 distinct phases of life, or the movie has an introduction, a beginning, a middle, an end, and then the climax. So if you only looked at the introduction and nothing else, you could say, well, this is a war movie. It's about a soldier's life during the war. But halfway through the beginning of the movie, it changes to the soldier's life after the war. But if you were only looking at the beginning, you wouldn't realize that, this movie is more than that. I mean, the person who only saw the beginning would say, well, it's about a soldier trying to fit back into the regular life. But then there would be a middle, and end, and a climax. And so those parts of the movie would be different. 5 distinctly different storylines in that movie. If you only look at one part of the movie, your impression is very different. That's how our life is. Medicine obviously deals with the latter half, the post 50 years of life. I mean, what we do in medicine is the early detection of disease, the diagnosing of disease, and the treatment. Well, that's the end of the movie. And so really, the 5 phases of life have to be looked at differently. And so let me just tell you what they are. The first one is called the optimal functioning phase, or it's the beginning. And then the second phase would be oxidation. The third is inflammation. The fourth is degeneration. And then the 5th stage is end-stage degeneration. Now, these are the 5 parts of our movie. And so the optimal functioning phase of life is 0 to 25. And we kind of jokingly call it the indestructible phase. Because the body, it just works perfect under 25. I mean, right? You're 22 years old as a male and you go parachuting with your friends. You jump out of the airplane and say, oh, crap, I forgot the parachute. So what? You hit the ground, bounce, it hurts, you laugh, let's do it again. Because the body fixes itself. It just seems like we're almost indestructible. Not really, but you get the point. All of you that are older than 25 or much older, you know what I'm saying. And then the next phase, which is really the beginning of the malfunctioning of the body, is the oxidation phase or over-oxidation phase, which is where our body starts to lose its ability to manage oxidation reduction, as I mentioned. And so that's where you hear health professionals talk about, free radicals and metabolic waste products are starting to eat us. And that goes on from 25 till about 40, 45. And people in their 30s notice the difference between 20s, but they still get better. It just takes longer. But the real movie gets going in the 3rd phase of life, which we call the inflammation phase or the 45 years old phase, when chronic internal inflammation begins. And what we're understanding now, that the first 44 years of life, shall we say, set us up for this, that the oxidative damage that's occurring from 25 to, say, 44 is partially dysregulating our inflammatory control mechanisms. And so now we start with chronic internal inflammation. It's the beginning. And it's much more damaging than oxidation or excessive oxidation. So now in the inflammatory phase, we really see our body changing. I mean, infections last longer, body aches last longer, many things occur. I mean, people always come in my office from 45 to 55 and say, Doc, what's happening? I mean, my body's like falling apart. We just don't get over things. And then 15 to 20 years goes by from that 45 years old, and we get in our 60s, and then we really change again. The 15 to 20 years of chronic, unrelenting inflammation causes degeneration. And you know what that word is, really? Disease. All diseases are degenerative. Degeneration and disease is the same thing. It's just what organ system gets broken in the body. We call it disease, congestive heart failure, chronic obstructive pulmonary disease, kidney disease. These are degenerative processes. This is where the body is permanently broken, not dysregulated like the inflammatory phase. So let me give you an example of this so you really get it. Let's say at 62 you have a mild heart attack. The heart attack occurred because of what's been going on in the inflammatory phase. But the heart attack is a permanent change or a degenerative change. And so if that change accelerates quickly enough, you'll go from the degenerative phase, another 10 or 15 years later, to the end phase, which is end-stage degeneration. And that means now your heart is going to fail. It's the end of that organ system. Maybe a way to understand it a little better is through the knee example. I like to use the knee example. So let's say you're a carpet layer, and you, of course, started doing this when you were young, in your 20s, and you're indestructible. So you never wear knee pads, and you're always mashing your knees. Nothing seems to matter. But if you're very good at it, you will start to have inflammatory changes in the mid-30s, not the 40s, because you're abusing your knees so badly. So now, at 35, you can start to have inflammation of your knees chronically. Now, the rest of your body isn't there yet. And then, by 45, instead of starting inflammation, you're already starting to get degeneration or degenerative arthritis of your knees. I mean, they're hurting all the time now. I mean, you're pushing through it, you're working anyway. You're still being a moron and not wearing knee pads. Well, 10 more years of that, by 55, your knees can be already at end-stage degenerative arthritis. It's not the beginning arthritis anymore. It's end-stage. Well, that means your knees are dead. The bone tissue, the cartilage, it's dead. At 55 years old, you've killed your knees. So what do you have to do? You need knee replacements. I mean, the knees are dead, and it hurts all the time just to stand. You're not working anymore. And so you get knee replacements, and if it goes well, you would be okay. Well, that's a non-vital organ. What if your heart does that? See, when you go from congestive heart failure, which is really degenerative heart disease, and it becomes complete heart failure, well, your heart's going to fail. You're going to die unless you get a heart transplant. But good luck with that, because over 55, 60, you're not getting a heart transplant. And so every organ in our body is marching through these phases. And so you see now the importance of stopping this as soon as possible. And so we're learning more and more about the oxidation phase and trying to minimize that so we don't get into the inflammatory phase. But it just seems like it's a matter of time. As I've watched this now for the past 6 years with knowledge, it's a matter of what decade do you get into the excessive inflammation of the chronic inflammatory phase of life. But now we have these amazing tools of using high-dose antioxidants. In this case, now resveratrol, because the other one that I'll mention, anatabine, which used to be called Anatablock, is no longer on the market. It probably was the best one. Well, no, it probably was the best one. But I'll talk to you about that. And so as far as concluding today, the little introductory podcast about this, chronic inflammation is what we need to stop. It has the most devastating effect on our body. And cancer prevention, based on the science, which I really didn't get into details, if you get my book, you can get the details. But if you want to prevent cancer, there is not a nutrient anywhere that will have more of a cancer preventative effect than resveratrol and doing the anti-inflammatory treatment. And I'll mention that later in a little more details. But for now, as I just alluded to, my book, if you want to get it, I think it's like $8. It's on Amazon Books. I think it's only an ebook right now. Yeah, in fact, it is only an ebook. But the only way you'll find it, because there are 8 zillion books on oxidation and inflammation, if you go on Amazon and plug in my name, then it'll pop it up because it's the only book I've ever written. But it will give you all the research, all the information, all the details. Now, the book's 4 or 5 years old now. And so on the podcast, I'm updating the stuff that won't be updated in the book. So the numbers will be different, the years and the studies. But I just want to finally say, listen to the podcast, listen to the other ones, because it is probably right now the most important podcast regarding a specific thing you could do that'll change your health outcome. And as I'll mention, it's cheap. Long-term therapy with resveratrol, because it's something you'll do for life over 45, 50 years old, is $5 to $8 a month, maybe, at the most. So that's it. I'm Dr. Debunk, debunking medical myths, garbage, and crap spread by doctors and other health professionals. And this has been an introduction to oxidation and inflammation. Thanks for listening.